Hello friends, this is Sonu and today I'm going to discuss the general anesthesia. As I discussed in the last videos, that is the local anesthesia. So today we'll discuss the general anesthesia. First of all, what is the general anesthesia? General anesthesia are drug which produce the reversible all types of sensations, loss of all types of sensations and consciousness. That is called the general anesthesia. So very simple definitions. And what is the main feature, main cardinal feature of the general anesthesia? So let's discuss the main cardinal feature. Main feature of general anesthesia. First, it is said in a definition, it's a loss of all types of sensory, loss of all types of sensation, mainly pain, burn. Second is a muscles relaxment. Muscles relax. Third, unconsciousness. Like whenever they apply the general anesthesia to any person or any patient, the patient will be sleep. So unconsciousness. Third, amencia. What is amencia? Amencia is a loss of memory. Loss of memory. Loss of memory means, like, of course patient know before and after the surgery, but during the surgery patient will not remember anything. That's why the main feature of the amencia, loss of the memory. Due to that, like whenever they apply the general anesthesia, the patients will not remember anything during surgery. So that's why amencia is developed. Fifth, the abolition of somatic and autonomic reflexes. So these are the main feature of the general anesthesia: loss of all types of sensation, muscles relax, unconsciousness, amencia, and abolition of the somatic and autonomic reflexes. So this is the very important feature that should know. And now we'll discuss the stages. That what is the stages, because it's very important and mainly important for the anesthesiologist, because mainly the general anesthesia given by the anesthesiologist. So stages. We have two stages, like one is the general stages, one is the depth of the stages. Depth of the stages means we can say that degree of the anesthetic drug and degree of the anesthesia which depress the CNS, and you can say that whatever amount you inject or you apply to the patients, and how much the CNS become depressed. So that is the depth of the anesthesia. And yet the normal stages, like main stage of the general anesthesia. So main stage of general anesthesia. First, induction. Second, second is maintain. And third, recovery. So what is induction? Induction means its time to administration or time to the giving the anesthesia, and the development of the like very potent effective anesthesia, that is called induction stage. For example, like any patient to start the giving general anesthesia, and whenever you inject the general anesthesia by any way, they become anesthetized, like the patient become anesthetized. That period is told, that stage is induction stage. Like you start to give in, and then after like 1 minute, it depends on the drug efficacy, after 1 minute 2 minutes patient become anesthetized. That stage is called induction stage. Second is a maintain. Maintain means, by what, by the name you can understand, it's a maintain the general, like it's a maintain the anesthetic property in the body. How, for example, any patient needs surgery, and surgeon to need surgery for 2 hours. So anesthesiologist apply the general anesthesia. For example, like they inject 1 ml of anesthesia, just for understanding purpose, 1 ml, and patient become anesthetized. For example, their drug efficacy is for 30 minutes. For 30 minutes. But surgeon need 2 hours. That's why for after 30 minutes or like before 20 minutes, again anesthesiologist will apply 1 ml, one drug again like same drug for the further anesthetize. So that is called maintain, because it's maintain the anesthesia during the surgery. So the name is maintain. Now, and the third one is the recovery. Recovery means it's time to discontinuation, like after the end of the operations, until the patient will not recover in a normal behave or normal, like all types of reflexes become recover, and the patient's in a consciousness stages. Till that stage, the anesthesiologist have to see the patient very carefully. So that stage know the recovery, like patients in a recovery in normal stages. So these are the main stages: induction, maintain, and recovery. And now we'll discuss the depth of the stages. What is the depth of it? And the depth of the stages is very important to understand of the anesthesiologist, because it's really very important how we discuss. Depth of stages. Depth of the stages, as I said, it is the degree of the anesthetic drug, and which like they depress the CNS. How much depress the CNS? That is called the depth of the stages. It has 4 stages. It has 4 stages. First stage, it's called analgesia. Analgesia, all know, is the loss of pain. So first stage means whenever you applying the general anesthesia, the first appearance of the patient, you can see the analgesia. So first stage analgesia. In this stages, the patient just will not feel any pain, but patient can move. Patients can, like, muscles become contract. Patients in a conscious mood. Just analgesia will be developed. That's called analgesia stage. Second is excitement. Excitement. We can say it's a very bad stage. In these conditions, like after you like inject 0.5 ml, you can see the patient's analgesia property. But after 1 ml, the patient have excitement, means all sympathetic nerve system becomes highly stimulated. In this condition, the delirium will be appear, like acute confusion phase. There will too much excitement, irregular respiratory rate, irregular cardiac output, blood pressure become fluctuations, and arrhythmia can be developed. So that's why the anesthesiologist try to reach very fastly in the third stage. Third stage is a surgical anesthesia. Surgical anesthesia. This stage is the good stage, or we can say for the surgeon it's a very good stage, and even the patient for the good stage. In this stage, the muscles become relaxed, and the respiratory become normal. All reflexes become, you can see the normal, and eventually the patient become all types of anesthetized. So in these conditions, surgeon can do incision, surgeon can do surgery. That's why this condition is, can see, good conditions. And the next one is a fourth. Fourth is a very dangerous conditions, that is called medullary paralysis. Medullary paralysis means, medullary paralysis, by the name you can see the medulla become paralyzed, and as we know that medulla oblongata is a very important organ, even which is the root of the brain. So like if you inject the drug concentration is too much, and anesthesiologist did mistake, so on that condition medulla become paralyzed, and whenever medulla become paralyzed, it means all types of center of the medulla, they like lot of function are generating every time, every second from the medulla oblongata. So whenever paralyze the medulla, it means what? Our respiratory center in a medulla oblongata, vagus nerve in a medulla oblongata, our cardiac center in a medulla oblongata, a lot of centers are there. So it means they all are paralyzed, and whenever they all are paralyzed, it means what? Respiratory paralysis can be occurred, the cardiac arrest can be occurred. That's why it's a very dangerous conditions. In these conditions, patient can go in a coma and eventually can be die. So good, very good stage is the general surgical anesthesia stages. Mostly in these stages, they do operations and all things. So these are the stages that are very important stages for the anesthesiologist. Is really very important. Now we'll discuss the classification. That is the very, of course it's important because it's a pharmacology. So classification. Classification. The general anesthesia is divided into two types. First inhalational and then intravenous. So let's discuss inhalational. Inhalational general anesthesia. It becomes further divided in a two part. Gaseous and volatile liquid. Volatile liquid. In a gaseous form, we have one drug that is very popular, nitric oxide, or in shortcut NO. Nitric oxide. In a volatile, very popular, even all are known, ether. Then halothane. Isoflurane. Desflurane. And sevoflurane. So this is the inhalational general anesthetic drug, and then intravenous. it also further divided in two parts, long acting and slow acting, or we can say fast acting. Sorry, it's a fast acting, not slow acting. Fast acting. Fast acting. In the fast acting, we have thiopentol sodium, thiopentol sodium, methohexinate sodium, propofol, and etomidate. They are the fast acting. And then slow acting. In a slow acting, the group of the benzodiazepine, you have diazepam, lorazepam, and midazolam, and alprazolam. A lot of drug. This group is a benzodiazepam group. This drug we'll discuss also whenever we discuss the hypnotic drug, sedative drug, anti-epileptic drug. But here also we'll discuss. And also the very popular drug, ketamine. It is a dissociative anesthesia. What is the dissociative anesthesia? We'll discuss later. And then opium alcohol is a fentanyl. Again, we'll repeat the classification. We have inhalational, intravenous. Inhalational, we have gaseous and volatile liquid. Gaseous have nitric oxide. Don't confuse with, no, it's nitric oxide. Volatile ether, very popular drug, but nowadays we not use. Behind the reason we'll discuss. Halothane, isoflurane, desflurane, sevoflurane. Next one, the intravenous. Fast acting, slow acting. In fast acting, we have thiopental sodium, methohexinate sodium, propofol, the spelling Propofol, propofol. It's not A, it's O, propofol, etomidate. These are the fast acting. And the slow acting have diazepam, lorazepam, midazolam, alprazolam, a lot of drugs which belong to the benzodiazepine group. And ketamine is a dissociative anesthesia. What is the dissociative anesthesia? We'll discuss also. And fentanyl is a opioid alcohol. We also discuss, each drug will discuss. So this is our main classification of the general anesthesia, and we'll discuss the main property of the inhalational general anesthesia and the intravenous general anesthesia. What is the main property? Like in some property that you should know in the inhalational anesthesia and the intravenous anesthesia. So now we'll discuss the main property. Before the start, discuss the general like inhalational and intravenous. We will discuss some normal thing. We'll discuss start inhalational general anesthesia. But before the start main properties, like we have to know something. First, drug should be unionized, as in discussed also in local anesthesia. Unionized. Second, it should be in a lipophilic compound. And third one is also depend only the two things are applying every pharmacological drug. but this one is the applying here only for the general anesthesia. It depends upon the solubility of the drug in a blood. So it's depend upon the solubility. Solubility means whatever amount are soluble in a blood and whatever insoluble. So it's depend upon also in solubility. So there are three things: unionized, lipophilic, and solubility. The three are in inhalational general anesthesia. I'm talking about this thing. So unionized and lipophilic are applied in every drug, but solubility here only the general anesthesia. So this is the three main important concept. And now start for the general main property of the inhalational anesthesia. First, we'll discuss the first minimum alveolar concentration. Minimum alveolar concentration, or shortcut we can say MAC. So it is a low concentration of the anesthesia in a pulmonary alveoli. It is the minimum concentration of the anesthesia in a pulmonary alveoli. That is called minimum alveolar concentration. What is the minimum alveolar concentration? How you will understand? Let's give the example. Here patient 1, I mean A, and here patient B. You giving any drug just for the nitric oxide, giving 5 mg, patients A, and here you giving 30 mg. And after giving, you saw that even in a 5 mg, patient become anesthetized, and patients A and patient B you giving 30 mg. After that, patient become anesthetized. It means what? That 50% of the people become anesthetized in a very low doses, and the 50% of the people will be anesthetized in a high doses. It means it's a potency, we can say potency. It's inversely proportional to the MAC, minimum alveolar concentration. Means if you apply low doses in a 50% patients, you can see very good actions, and in 50% people you will apply high doses, then you can see the good anesthetic conditions. It means the minimum alveolar concentration in a 50% have very good anesthetic properties. That very low doses, if you give a very low doses, and the patient become anesthetized. And in some patient, like 50% of the people will be anesthetized in a high doses. Means here is the high potency and here is the low potency, because in very low doses patient become anesthetizing, and here is a high doses, then patient become anesthetized. So this is the main concept of the minimum alveolar concentration. What is the minimum alveolar concentration? This is the minimum alveolar concentration. Next we'll discuss next point, arteriovenous concentration gradient. Arteriovenous concentration gradient. What is this? It is the concentration of the general anesthesia from artery to venous. What is the concentration? So let's discuss, let's understand what is this. For example, this is our artery. Here capillary. And here again vein. Artery, capillary, vein, and here peripheral tissue. So here, just for understanding purpose, let's take 100 mg of any anesthetic drug, and 100 mg, when it circulate in a blood, it will absorb 80% of the, from 100 mg it absorb 80%, and in vein it 20 mg will be there. It means what? What is the arteriovenous gradient? 100 minus 20 equal 80. So 80 mg, the arteriovenous gradient means 100 mg it absorb 80%, and then in a vein it go 20 mg. This is for the patients A. Let's say patients B. The same diagram will be drawn. R3. Capillary. And then become vein. Now don't forget peripheral tissue. So the same condition, 100 mg of any drug, but here it's absorbing 20% and 80% go in a vein. So what is the arteriovenous concentration gradient? 100 minus 80 means 20 mg. So here the arteriovenous concentration in patients B 20 and here 80. But which one is more potent? Which one is generate more anesthesia? In this condition, always student will be confused that here is a more absorbing means it's a more anesthetic, and here is a less absorbing means less anesthetic. But just opposite, it's a very potent anesthetic and it's a very weak anesthetic. Why? See, in these conditions, 100 mg, it 80% absorbing in a peripheral tissue means what? Just 20% are drug which going in a CNS. And in these conditions, 100 mg from the 100 mg of the drug, just 20% are absorbing in a peripheral tissue and 80% of drug is going in CNS. Due to this reason, patient B is a very potent anesthetic as compared to patient A. And it's depend on the blood solubility. If any drug is like we have lot of anesthesia, but some of the anesthesia will soluble in a blood more as compared in some drugs in a blood soluble is a very less amounted. So it's depend upon the solubility. If more soluble means potency action become low because it's too much absorbed in a peripheral tissue, and it's a less soluble means potency become high. It's not too much absorbed in a peripheral tissue, and it most probably drug is to go in a CNS and becomes an anesthetic. This is the second example, and we'll give one more example for the better understanding. Just take two tubes. And tube have water. Here also water. Here you give 1 spoon salt. Put the 1 spoon salt in the water, and here 5 stone. 5 stone put on the water. After like even 1 minute or 2 minutes, you can see this the water gradient, water pressure will be same because it's a dissolved in a water. It's a very good soluble of the salt. Salt is a good soluble in a water, so water becomes the same. But here a stone is insoluble. It means what? It will not soluble in a water, and when we apply, water will go in a stone will go in a water. The pressure become high, and when the pressure become high, it go out. So the same condition in the general anesthesia means if the general anesthesia more soluble in a blood, it will not act. It will not start act very rapidly, but it's a but whenever it's not soluble in a blood, it's act very rapidly and start the act very rapidly. That's why insoluble general anesthesia acting very good and very rapidly as compared to the soluble general anesthesia. So these are the main, we can say, the pharmacokinetic, you can say it's a main pharmacokinetic of the all inhalational anesthesia, that how it's absorbed, what is the main properties, to need the understand. Again I will repeat, first the unionized, because ionized drug cannot penetrate any cell membrane, even not brain, any cell membrane. First, drug should be unionized. Second, it should be lipid compound, because our cell membrane made by the lipid, and whenever the drug will be the lipid, it's love to bind the fat and become more easy to penetration. Is the two condition, unionized and lipid, for apply the all drug. But for the inhalational general anesthesia, the insolubility is very important, because if drug will not insoluble, they will not act rapidly. Why? We'll discussed already. And for the intravenous general anesthesia, for the intravenous general anesthesia, the same, it's a rapid onset of the action. Second, mainly the intravenous general anesthesia used for the maintenance of the inhalational anesthesia. We can say that spontaneously will give the general anesthesia, and then spontaneously will give the intravenous anesthesia for the maintenance the anesthetic properties during the surgery. So mainly is used by combination of the general inhalational anesthesia, and in some time, for example, like in any conditions you don't have any local anesthesia, or maybe some allergy or some intolerable for the patient by the local anesthesia, on the time you can use the intravenous general anesthesia. But more like it's used mostly by the inhalational combination with the inhalational anesthesia. Second, what's the main property? First, unionized, as I said, lipophilic, the same. And third is it's depend on the whatever it's binding to the plasma protein. So plasma protein, the capability of the binding power of the plasma protein, binding. For example, if it's binding the 80% and 20% will move in a free in a blood, so the free 20% will be act on a CNS. So it's dependent upon the binding properties. If binding 20% and 80% in a free, it means this drug will be more potent as compared to this one. So first, unionized, second, lipophilic, and third, the binding properties. Binding property, that unbind material can be act on a CNS. So for the inhalational, unionized, lipophilic, and the solubility, like insoluble is more best. Here the same unionized lipid and the binding protein, because the unbind unbind drug are the more potent. So here we discussed the main basic thing of the general anesthesia. In the next session, we'll discuss the all drug mechanism of action, indication, contraindication, side effect of the individual drug. Thank you.